Why would a doctor spend so much time doing non-doctor things? Hello, I'm Alexander Lakowski, a board-certified internal medicine physician in private practice in San Francisco Bay Area. And I'm also the founder of Reimbursement Rx. By now you've seen a lot of videos that I put out, a lot of posts that I put out, and I've gotten a number of comments from a lot of you. And I guess one question that is still on everybody's mind is, well, who am I? Truth of the matter is that I'm no different than most of you. As I mentioned, I'm in private practice. I strive and want to do the best for my patients, make sure they get everything they need, and make sure that at the end of the day, I do the right thing. And I'm certain most of us in the profession do that, and that's what most of us want. Now, how I got here is probably a little different. I want to go back to my third year of medical school when I began doing my clinical rotations at Methodist Hospital in Brooklyn, New York. I was flabbergasted by the fact that the attending physicians who I worked with did a lot of work, did a lot of medicine, but they did more non-medical stuff. They fought with insurance companies. They fought with Medicare. They fought with hospitals. They did a lot of things that did make sense to me back then. I was only a third-year student. Why would a doctor spend so much time doing non-doctor things? And then they always complained. They always complained about how little they get paid. Now, I wasn't privy to the actual information about what exactly they got, but the common theme was that everyone complained. And going further in my third and fourth year medical school training, I observed that a lot of physicians, both attendings and residents who were supervising us, would order tests, would send patients for consults, for imaging, for everything, without really knowing what they were doing as far as the cost and financial implications on the patient. Later on, moving on to residency, when I was the one ordering those tests, I began to ask myself, well, how much does this cost? And why do I need to know that? Because the answer was very simple. I mean, patients would ask, but you know, when you're in training, when you're a resident or a fellow, you don't really deal with that part, yes? That goes to the attending. So you just go along and you just do whatever you think is the right thing to do without any regard as to how much things cost and what the cost is to the patient. So having those questions in mind, I wanted to better understand the business of medicine. So I decided to enroll in the Executive MBA program, and I did that at University of Massachusetts Amherst while I was finishing up my residency at UMass in Worcester. Having gained some business knowledge and business know-how, I was able to understand how business foundations are laid and how businesses can flourish or come apart. One thing became apparent to me is that the world of medical business, at least in this country, is very different from any other business from ground up. After residency, I became an employee of a private multi-specialty group. I was there for a couple years and then moved on to a private independent internal medicine group, still trying to learn more and still trying to apply the knowledge that I gained from years past and from my business education in order to be able to be a better physician and a better patient advocate. About 5 years in, we were acquired, like many of you have, by a hospital. Now in California, hospitals cannot employ physicians, so we were acquired by a large hospital foundation, which is essentially the same thing. And I became a true employee. And I could only last there for 2 years because I could not stand the bureaucracy, I could not stand the hierarchy, but most importantly, I did not like the fact that we as physicians had no control over how much our patients are being charged, over where we can send them, and over how we practice overall. So what I did the opposite. I did something very few doctors do these days. I got out of employment, and I opened up my own private practice right across the street from the hospital. Now I'm very lucky because I have a great partner who's actually my wife, who's also an internal medicine physician. We've been working in a private practice across the street from the hospital for the last 6 years, and we'll never look back. It was not always easy. It was difficult at times, especially in the beginning, not so much to build and maintain the practice, but to deal with other aspects, just like I told you about in the beginning. Same aspects that those attendings that I worked with as a third-year medical students were dealing with. But building upon my previous knowledge, building upon my business expertise, I was able to circumvent certain angles, I was able to ensure better contracts, and I was able to make sure that we treat patients how we wanted them to be treated, and that we know what they're going for and how much they're going to pay anywhere we send them, anything we order, so that there's no surprises. Now, after talking to many of our colleagues, many physicians in areas and across state, it became apparent to me the doctors still don't understand how to do things. And physicians are still complaining about how little they get paid, how much more and more non-clinical work they have to do in order to maintain the current level of income, and how little say they have in patient care, and especially the employee. I'm not here to vilify employment or extol private practice. I think that anyone, any medical provider in this country should be able to practice medicine in a way that brings both personal and professional satisfaction. That led me to start Reimbursement Rx. Once again, I'm Alexander Lakowski, and this is my story.